Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's learn the remaining chapters 15 to 18 from ICD Codebook. Chapters from 15 to 18. In this chapter 15, which is a very important chapter, which consists of O codes. Okay, so O, P, Q, R codes we will learn today from 15 to 18. So before that, friends, if you are new to the channel, please support me by subscribing to the channel and please press the bell icon so that you will be receiving notifications. Okay, so let's move to the chapters one by one. So let's move to chapter 15, which consists of O codes. These are the codes in pregnancy. Okay, pregnancy related codes. So this is a very important chapter. You will definitely get one or two questions from this chapter. Okay, so O codes. What is the code for normal pregnancy? Z34. Z34 represents the code for normal pregnancy. I will just explain few codes and then the conditions related to that. Okay. If a patient has come to treat sprain but she is pregnant, so code for the sprain first, then code Z33.1. So if a patient is coming to the hospital or to the physician, to the gynecologist to treat the sprain, not gynecologist, to some physician, some specialist doctor to treat the sprain, but she is pregnant also. But for what condition the patient has visited the hospital? For sprain, right? So code for sprain first, followed by the unrelated code, because pregnancy is not related to sprain. So that's why Z33.1, which represents the unrelated condition of pregnancy. Okay. Now, for elective C-section, we will use the code O82 for elective C-section. Okay. Now, if the baby is in breech position, code only breech code and no C-section code. Breech position means the head is on the top. So, if the baby is in breech position, we should code only breech code. We should not use the C-section code, because usually for breech condition, 90% will be C-section. So, we will not code for C-section. Instead, we will use only breech code. For IVF treatments, you should use O09.8. O09.8 means supervision of other high-risk pregnancies. For high-risk pregnancies, all high-risk pregnancy-related conditions, you have to use the code O09.8. So for IVF also, you have to use the code O09.8 along with the gestation, weeks of gestation code. That is Z3A. Z3A, always you have to code for pregnancy-related conditions. Okay, at the end. What are the number of weeks? Okay. Now, another example, a 14-year-old during a visit, ultrasound notices the fetus is small for days. The fetus is very small during the ultrasound. So, what all you will code? First, you have to code for O33. O33 means maternal care for known or suspected disproportion. For all like fetus or some disproportion, something unconditional or something which is little complicated, you have to use, like for the mother, complication for the mother, you have to use the code for maternal care, which is O33. Okay, because here the mother is only 14 years old, so maternal care is important. So O33. Now along with that, you have to use the code for high risk pregnancy, O09. And then Z3A. If it is 8 weeks, you have to code Z3A.8 like that, 8 weeks. Sorry, like that you have to code the weeks of gestation. Okay. Now, which are the conditions in pregnancy? What are the conditions that can affect during pregnancy? DI. That's one of the main condition which can be affected during pregnancy. Diabetes. Okay. This can be either pre-existing diabetes or it can be a gestational diabetes. Pre-existing means before the patient gets pregnant, the patient is already having diabetes. And gestational DM, gestational diabetes means after getting pregnant, the patient got diabetes. Okay. So for pre-existing condition, you have to use the code O24, DM in pregnancy, and then E10 code, type 1 diabetes. Okay. For gestational diabetes, we will not use E code. Instead, we will use only O code, O24.4, because that condition, in gestational diabetes, it means diabetes arises during pregnancy. So we will use only the pregnancy code, O code. But for pre-existing, since the patient was already having diabetes before getting pregnant, so you have to use the code for diabetes during pregnancy along with the E code for the DM. Okay, type 1 or type 2, whatever it is. Now, HIV in pregnancy. For HIV in pregnancy, you have to always use the code O code, which is O98.7, followed by the HIV code. Okay, so HIV in pregnancy, O code followed by HIV code. O code is O98.7, means HIV in pregnancy, followed by the HIV code, Z code. Okay. Now, alcohol use. Again, alcohol use in pregnancy. These are all conditions in pregnancy. Okay. So, alcohol use in pregnancy, O code followed by F10. F10 is alcohol related disorders. What are the disorders? In like alcohol use, tobacco use, smoking, everything, it will come under F codes. So, if a pregnant patient is having all these uses, then like alcohol use or smoking, tobacco use, you should always code O code first, followed by the F code. See, tobacco use, O code followed by F17. Now, abuse codes. There are certain abuse codes also, that is O9A. Now, what is sequela of pregnancy? Sequela means complication. For coding sequela of pregnancy, you have to code O94. For example, postpartum depression or postpartum hemorrhage. Okay, after delivery, postpartum depression, postpartum hemorrhage. These are all the complications of pregnancy, which is called as sequela of pregnancy. So for that, you have to use the code O94. Now, code O90.3. O90.3 represents cardiomyopathy in the puerperium. Use this code only when the patient is having a pre-existing heart disease. So, for cardiomyopathy during pregnancy, cardiomyopathy in the puerperium, you have to use the code O90.3, but we will use this code only when the patient is having a pre-existing heart disease. Cardiomyopathy suddenly will not arise during pregnancy, right? If it is a pre-existing, then only we will use this code. Okay, O90.3. It means patient is already having cardiomyopathy, but she is pregnant. Now, Z39.0 represents postpartum care. Z39.0 for all postpartum care codes, you have to use Z39.0. And how long is the postpartum care? From the delivery till 6 weeks. From the date of delivery till 6 weeks, we will consider it as a postpartum care. After that, it will go to the routine days. Okay. So that's all about O codes, pregnancy codes. Now let's go to chapter 16, P codes. P codes usually represents the codes for the baby, newborn, infant, codes for baby. Okay. Newborn baby, the number of days for the newborn baby is till 28 days only. From the birth till 28 days, we will consider the baby as newborn baby. Now, code Z38 only for newborn first day. Newborn first day, we will use the code Z38. Now, for any suspected disease, Z05 is the code that we will use for any suspected disease for the newborn. If for example, in the documentation, the suspecting disease is mentioned it on the first day, then we will use both the codes Z38 and Z05, because Z38 represents newborn for the first day. If suspecting disease is mentioned in the documentation on the first day, then we will quote both the codes, Z38 and Z05. If the suspecting disease is on second day or third day or something like that, from second day onwards, you have to code only Z05, the suspecting disease code. We will not use the Z38 code, okay? Now, if the disease is confirmed, don't use Z05. Code only the disease. The disease is confirmed, we will not use the Z05 code, but we will code only the disease. Because it is not suspected, it is confirmed. That's now, if community acquired disease, we should not use P codes. P05 represents full term baby, but low birth weight. P05 represents full term and low birth weight, whereas P07 represents preterm babies, P07. So for preterm babies, you have to always code for the birth weight first, then the gestational age, because it's preterm, right? So we have to code the gestational age also, but always first code for the birth weight. Now, an example, a baby is born around 24 weeks, weighs 1000 gram. 1000 gram means only 1 kilogram. Sometimes they will mention the weight in LBS also, okay? So how will you code? A baby born around 24 weeks, weighs 1000 gram. So we have to code first the birth weight. So P07.14 represents other low birth weight newborn, 1000 to 1249 grams. So this is the, according to the birth weight, you will get the code. So 1000 to 1249 grams is a low, because in our question it is 1000 gram. So you have to check for that code and code for that, the low birth weight code. So here it is P07.14. And then P07.23 represents extreme immaturity of newborn, gestational age of 24 completed weeks. So here you have to code for the number of weeks, gestational age, which is 24 completed weeks. So these are few codes from P codes, chapter 16. Okay. Now let's look into chapter 17, which is Q codes. Q codes represents codes for congenital defects. Not much guidelines in this. If the defect is corrected, we should not use the Q code. Instead, we will use the Z code. Some congenital defect means by birth. Some diseases by birth are called as congenital diseases. So, codes for congenital defect falls in Q codes. But if the defect is corrected, we should not use Q codes. Instead, we will use only the Z codes. For example, a newborn live infant delivered vaginally is diagnosed with Down syndrome. So, a newborn baby is delivered vaginally, but the baby is diagnosed with Down syndrome. So, you have to code for the delivered vaginally, like normal delivery code Z38.00 along with the Down syndrome code, which is Q90.9. Okay. So, not much guidelines from Q codes. Now, moving on to R codes, which is in chapter 18. R codes also, you will get number of questions from R codes, but where are we using the R codes? If there is no confirmed diagnosis, we will use signs and symptoms. So R codes always includes, or R codes always represents the signs and symptoms, abnormal results of clinical or other investigative procedures. Use R codes for the following conditions. We will use R codes for these following conditions. You have to just remember all these conditions. Not like only these conditions you have to remember, no other guidelines for R codes, because it's very easy and it represents only the signs and symptoms when the confirmed diagnosis cannot be coded. So where can we use R codes? Which are the conditions? Cases for which no more specific diagnosis can be made. There is no proper diagnosis. Now, signs or symptoms existing at the time of initial encounter. If in the documentation, if the question is related to initial encounter, only signs and symptoms will be present, right? So in that case, you can use the R code. Now, provisional diagnosis in a patient who failed to return for further investigation or care. Like, for example, a physician has requested the patient to do a follow-up for further investigation, follow-up for care. In that case, if patient failed to visit the doctor, then we can, like, for confirming the provisional diagnosis, the doctor has requested the patient to come back for a follow-up, but the patient didn't do that. So in that case, you can quote R as a diagnosis. Now, cases referred elsewhere for investigation or treatment before the diagnosis was made. During the initial visit or second visit, if the for example, a PCP doctor, primary care physician, that doctor cannot investigate what exactly the diagnosis is, but the doctor has been referred to some specialist. So in that case, that doctor cannot like mention that doctor cannot put exact diagnosis, a confirmed diagnosis, because he cannot find it out. So in that case, he should use the R code, okay, because only signs and symptoms can be marked for the referral. Now, cases in which a more precise diagnosis was not available for any other reason. For more precise diagnosis is not available, exact diagnosis is not available for one or other reason, then we need to use the R code. Now, certain symptoms for which supplementary information is provided. Some symptoms for which additional information is needed to diagnose, proper diagnosis. In that case also, you can use only R codes. So friends, these are few guidelines from the chapters 15 to 18, O, P, Q and R codes. Among this, O and R are important. You will get number of questions related to this. Okay, because the questions will be like combined, right? In a single question, you will get, sometimes you might get only a single code, sometimes you will get multiple, not sometimes, mostly you will get multiple ICD codes. So in that O and R codes, you will get number of codes. Let's do the mock questions in the next episode. So you can just stay tuned. I'll be coming back with the mock questions soon. So friends, if you like this video, please like and share. And if you're new to the channel, please support me. Please subscribe to my channel and please press the bell icon so that you will get all the notifications when the new video is getting uploaded. So thank you so much. If you have any doubts or inquiries, you can mark it in the comments and I'll be replying it back soon. Okay? See you in the next episode. Bye.